Casano Life Cycle Strategic Plan Part 7 Marketing Strategy. Now let's take a look at the drivers and barriers in diabetes. The number one driver in this case would be the increasing incidence in type 2 diabetes in the largest drug market in the world, the United States, with China and India not too far behind. And one of the major barriers to Casano is an entrenched competition with many competitors across different classes. So in the DPP4s, we have Merck's Januvia, we have Bristol Myers Squibb's Onglyza, and the GLP-1 agonist, we've got Victoza, and a brand new SLG2 inhibitor, Invokana. Now moving on to the SWOT, which stands for strengths, weaknesses, opportunities, and threats, we'll take a look at one of each. Right, for Casano, one of the major strengths is that it's got a 10,000-fold selectivity for DPP4 versus 2,500-fold for sitagliptin. Weakness, one of the major weaknesses of Casano is it's got a perceived subpar risk-benefit profile due to delayed regulatory approval, which kind of dampens things, but overall it makes up for all that in its stellar pharmacokinetic profile. In terms of opportunities, one of the major opportunities that Casano has is that they've basically got a concerted Takeda's got a concerted franchise strategy across the whole family of allogliptin products, which none of the other competitors have, which is actually a very good opportunity for them to really get ahead of the competition. One of the major threats for any medication, not just Casano, would be that there's a poor perception among payers, leading to a disadvantaged tier placement. You don't get good placement there, it's not going to pay for your drug. So marketing strategies. Let's look at the 4 P's and the 4 C's. Product. It's a combination product with a superior pharmacokinetic profile, best in class, favorable risk-benefit profile. For price, it's at price parity with the other DPP4 inhibitors. The place, for endocrinologists is their main focus, and the promotion is mostly targeted again to endocrinologists with e-marketing and speaker programs. Now let's take a look at the 4 C's. Customers. One of the major customers right now are physicians. They're looking at, for them, they're focusing on a favorable risk-benefit profile with greater A1C control. Convenience. You can't beat the convenience of a fixed dose combination, easy BID dosing. Cost, again, we're at price parity with the other competitors. Communication, currently there isn't much communication to consumers or except for the professionals, but even then it's very little compared to anybody else this early in the game. At the time of launch, we'll take a look at, say, in 2005 when they filed the IND for allogliptin. The only classes available at the time for diabetes, for type 2, were the DPP4 inhibitors, the biguanides, the TDZs, and the SUs, which are the sulfonylureas. And one of the major DPP4 competitors was sitagliptin. That was Januvia, the first DPP4 inhibitor approved by the FDA. In 2013, the pictures changed quite a lot. Now that we have DPP4 inhibitors, we've got biguanides, TDZs, sulfonylureas, GLP-1 agonists, SLG2 inhibitors, and in the DPP4 class, we've got sitagliptin, which is Merck's Januvia. We've got saxagliptin, which is Bristol Myers Squibb's Onglyza, and we have linagliptin, which is Tradjenta. Let's see here. Next, let's look at the drug value proposition. Now, we're going to break that down into burden of illness, clinical profile, quality, patient improvement, and price and value. Let's take a look at a point from each one. Burden of illness. Diabetes, it has an increased comorbidities that lead to hospitalization. So if you're diabetic, you can get foot ulcers, you can come down with a lot of infections, nerve pain, and so forth. You end up in the hospital. Clinical profile, let's take a look. It's got improved efficacy and a large combination sample size that really drives home its pharmacokinetic profile. Quality patient improvement. the fixed dose combination is convenient, and with the convenience, you get compliance. And in the end, compliance trumps everything else. If the patient's not going to take their medication, it doesn't matter how good it is, it doesn't really matter. Now let's look at the price and value, right? So you have a price parity with the other class. So in terms of price, there's no competition. They're all basically the same. So if that's the case, with Kazano, you're getting a great value. You're getting great A1C lowering abilities. You're getting great price. You're getting BID dosing. You can't really beat that. Uh, so in that realm, it's a great price and a great value. Now let's move on to the positioning statement, which is broken down in certain little pieces as well. So let's look at the target customers. Right now, it's endocrinologists. And Kazano is the DP4 combination of choice that achieves superior glycemic control over monotherapies. It's priced at parity with the other DP4 combination combos. Well, let's see here. The main point we're driving home here is clinical evidence proves that Kazano does have greater affinity for the DP4 inhibitor versus other established drugs in the same class, while providing a similar risk-benefit profile. Also, the fixed dose provides greater convenience for patients with type 2 diabetes. So bottom line is, for the money, you're getting value, you're getting convenience, which will lead to more compliance. More compliance leads to better outcomes. The pricing strategy. Well, I'm sorry, I apologize. There's no chart here. I don't know why it never came through. My apologies. But I'll read through here and you can basically picture the chart in your mind. Kazano follows a price parity pricing strategy with other DPP4 inhibitors. There's very little pricing difference across the different molecules, including the combinations. They're very closely priced. So that in terms of price, there's no advantage to any one of them. Now, it follows a similar strategy to other DPP4 that are approved in the market. There's combinations in the class are not priced at a premium. They're pretty much close to the single molecular entity as well. All DPP4s are priced at a discount to Victoza and Actos. However, no surprise that they're priced at a premium to generic metformin. Obviously, generic metformin, you can't compete against that. However, just the takeaway point here is that if you took generic metformin and you combine that with alogliptin, the price for Kazano, which would be alogliptin and metformin, is still less. So that is a major takeaway point there. Market opportunities, reimbursement strategy. Let's take a look at differentiation. To differentiate Kazano using a compelling payer value proposition that highlights increased binding affinity to other DPP4 inhibitor receptors versus other classes. So that's one of the great differentiators of Kazano versus the other DPP4 combination products. Non-inferiority versus other DPP4s. Well, we're going to reiterate the limited financial impact for payers that place Kazano on similar tier to other DPP4s and related combos. We're going to limit the payer management strategies. Well, for that, we'll take a look at, we'll limit the use of step edits and prior authorizations by detailing superior clinical profile. Easier for the patient, easier for the prescriber, everybody wins. As far as line extensions are concerned, there are no line extensions planned at this time. Novel indications. Well, the DPP4 inhibitors don't have any other indications outside of type 2 diabetes at this time. That can change, but at this time, there are none. Thank you.